morning and a very warm welcome from Lisbon to the launch of the European Drug Report 2022. We're very pleased to see this morning that around 350 people have registered for the event, so thank you very much for your interest and for being with us this morning. To start, if I may, I'd like to give you a few housekeeping details before we kick off with the speakers. First of all, interpretation. We're happy to offer this in a few languages, in 5 languages, so you may listen to the proceedings in English, French, Spanish, Portuguese, or German. And that's for those who have registered on the platform in advance. Next, should you have any technical difficulties during the press conference, you can hit the help desk button, which is on the bottom left of your screen, and somebody will assist you through that. Last, at the end of the press conference, as usual, we will have a question and answer session. This will be with the director, and you can already start submitting your questions by clicking the agenda button, which is at the top left of your screen. And from that, you can scroll down and you will see question and answers for journalists. So as I say, that's already functioning. You can submit your questions in written form in English, and those will be put to the director in due course. And please mention your name and the media outlet which you represent. So those are the housekeeping details to start off with. Now to the speakers. So I have the great pleasure and honor to introduce today our first speaker of the morning, and that's European Commissioner for Home Affairs, Mrs. Ylva Johansson, who today is joining us from Stockholm. So we'll just go to Stockholm with the Commissioner. Good morning, Commissioner. Very nice to see you.
Good morning.
Welcome.
Good morning, Commissioner.
So when you're ready,
Alexis.
Commissioner.
Good morning, everybody.
Good morning.
Yes, thank you.
When you're ready, please, you have the floor. Thank you.
Thank you. Thank you very much. And good morning to everybody. I'm very pleased to be here with you, even if it's only online. We are presenting this year's European Drug Report at a time when we are celebrating 25 years of the EU early warning system. 25 years of alerting Europe to the dangers of new psychoactive substances, of new drugs. Of those 25 years, the Drug Agency has warned policymakers of ever more novel, ever more potent, and ever more toxic drugs. The agency reported 52 new kinds of drugs last year alone, bringing the total to 880 kinds of drugs now under observation, testifying both to the agency's excellence in monitoring and the increasing threat drugs pose to our citizens' health and security. This year's European Drug Report shows that drug use rarely comes alone. It comes with mental health problems, with homelessness, with youth crime, and vulnerable people suffer the most. Social policies, health policies must go hand in hand with security policies. This year's report shows that after COVID disruptions, the drug supply is bouncing back. Member States' law enforcement are breaking new records in capturing drugs. In 2020, a record 213 tons of cocaine and a record 21 tons of amphetamine. The report shows that, like all of us, traffickers went increasingly online during the pandemic. Buying and selling drugs through social media is commonplace now. The drug report shows that criminal networks continue to operate on a global scale. Drug busts are up, but so is cooperation between organized crime groups across the Atlantic. The report shows us we must do more to fight organized crime. Last month, I presented a proposal on asset recovery to make it easier to trace, freeze, and seize criminal profits, to make sure that crime doesn't pay, to stop drug money from fueling violence and corruption. Drugs crime is the most profitable kind of crime. and these proposals will deprive criminals of their greatest source of income. And this report shows that we must still do more to reduce supply, reduce demand, and reduce harm, as outlined in our EU drug strategy and our action plan. That's why I propose to transform the European Monitoring Centre for Drugs and Drug Addiction into a fully fledged European Union Drugs Agency, with more staff, a bigger budget, and a stronger mandate. A mandate allowing the monitoring of polysubstance use, mixing of drugs, or mixing drugs, alcohol and medicine. Because mixing kills. Mixing drugs causes most overdose deaths. A mandate allowing examination of drug markets. Study, for example, buying and selling of drugs on the internet, social media, and darknet. A new mandate allowing early and deep investigations of complex new threats. For example, after the Taliban takeover, the rise in production of methamphetamine in Afghanistan finding its way to Europe, or perhaps the possible consequences of the war in Ukraine for drug use and supply. I hope the new mandate will be in place by 2024. Whatever happens, the drug agency's information and analysis will remain crucial to shape drug policies. And the drug report will remain our go-to source of data on drugs. This report builds on the work of many years. Each report gives us more complete picture of the challenge we face. I would like to warmly thank everybody that has contributed, and a warm thank to you, Alexis, and to your whole team for a job well done. Thank you very much.
Thank you very much, Commissioner, for your kind words and your contribution today. Thank you for being with us, and we hope to see you soon in Lisbon. Thank you very much. So next we go to Vienna, and that's to hear the thoughts of the chair of our management board, Dr. Franz Pietsch. Dr. Pietsch has been member of the board since 2002, and he represents Austria. So now over to Vienna.
It's a great honor for me as chair of the EMCDDA Management Board to introduce the European Drug Report 2022. This annual report delivers the latest overview of the drug situation in Europe up to 2022, exploring long-term trends and emerging threats. Based on data from 29 countries, thus as EU 27, Turkey and Norway, the report includes chapters on individual drugs as well as on drug supply, production and precursors. This flagship publication is an essential resource for gaining a strategic and holistic understanding of the European drug situation and its implications for public health and security. It illustrates the EU's balanced approach to explore the impact of long-term trends on the health and safety of the public and detect more quickly any new threats, enabling decision makers to improve their preparedness and response. The added value of the EMCDDA lies in its ability to help European and national policymakers and professionals in the drugs field to tackle the causes and consequences of drug use. As part of its Strategy 2025, the EMCDDA is therefore recalibrating its activities, proactively making them more customer-centric. For many years, the agency's task was to produce, share and disseminate data. Today, it is increasingly called upon to provide analytical and targeted information to allow policymakers and practitioners to develop evidence-based policies and services. In December last year, the EMCDDA Management Board adopted the principles of a new business model for the agency that will improve how it interacts with its audiences and how it identifies and responds to their needs. The COVID-19 pandemic has certainly reinforced the need for change, and I am pleased to see that the EMCDDA is engaging in such important developments. I would like to convey my special thanks to the EMCDDA Director and to all of its staff for this high-quality report. My thanks also go to the national focal points, to the EMCDDA Scientific Committee, and all national, European, and international partners who contributed to this analysis. Thank you for your attention.
Thank you very much, Dr. Pietsch, for your contribution. And again, we'll see you very soon in Lisbon for the next board meeting. So now I have the pleasure to hand over to the director, Alexis Goosdeel, who will present the key findings of the report. Over to you, Alexis.
Good morning, everybody. And first of all, I would like to express our warm thanks to Commissioner Ylva Johansson for permanent support, and also for Dr. Franz Pietsch, the chair of our management board. Are drugs different today? What can we do about this? Well, the answer is simple in a few words. Drugs are back. Drug supply and use is bouncing back in Europe. We reached again the pre-COVID pandemic levels of consumption. Increased complexity of supply and use, and a huge pressure from the drug market on the customers' base. First of all, 3 words to summarize and illustrate the situation today. The first is drugs are everywhere today. We never had such a high availability of drugs on the territory of the European Union. So 213 tons of cocaine have been seized in 2020, and even more in 21. 21 tons of amphetamines were seized in 2020, but at the same time, we see a change, an increase in the production of synthetic drugs on the territory of the EU, with up above to 350 laboratories that have been dismantled, and record seizures of new psychoactive substances. The next word is everything. Everything can be used as a drug, and it breaks the former old definition: soft, hard, chemical, vegetal, licit or illicit. There is a much broader offer of substances that are the support or the cause for addictive behaviors. New potent and hazardous substances are appearing every week on the drug market. With synthetic cathinones, a group of synthetic stimulants, being extremely worrying, and it has taken the second place as the second largest group of synthetic substances. Then we see an increase in the diversification of cannabis products, with some contents of cannabis in edibles, food, but also in e-liquid for vaping that may create potential new risks and new harms for people who are using them. And then locally, the emergence of crack use as one of the consequences of the high availability of cocaine, and also locally, still not in a very big dimension, but still increasing, it's the appearance of crystal meth at the city level in some cities in Europe. So the consequence, this is the third word, is everyone. Everyone can suffer and be impacted from those changes. It can be because of adulterated cannabis. What we observed recently is herbal cannabis that has been sprayed with synthetic cannabinoids, and that, for instance, can cause a delusional state. So for psychiatrists, physicians who have to assess the status of those persons arriving on the emergency room, it's extremely important to be aware of the existence of these sprayed synthetic cannabinoids in order to make a more correct, differentiated diagnosis. We also observe a huge increase in the concentration of cannabis resin in THC, which has reached now up to 21% of concentration. But we see also an increase in the health threats associated to cocaine. And in some countries, including outside the EU, like in the UK, we see the emergence of cases of death from overdose that are combining the use of cocaine together, for instance, with benzodiazepines. And then, finally, what we also observe is that there is a much broader range of substances that can be used through by injection. And last but not least, what is appearing as a recent change is that we see that there may be, at least in some cities in Europe, a correlation between the increase in the cases of overdose and the increase in the consumption of methamphetamine and chemsex. All of that shows that there is much more diversity in the number of people who can be affected by addictive behaviors and their harmful consequences, and that the drug problem today is certainly cannot be described only thinking in terms of heroin use. So what can we do? Well, we need to continue to protect youth. That's the main priority. We need to scale up treatment and harm reduction services. We need also to diversify, to adapt the offer of services to the needs and to the situation. And from that perspective, it's quite alarming to see that only 4 out of 29 countries, 27 EU member states, Norway and Turkey, only 4 out of them are meeting the WHO objectives, targets that consider the minimum number of syringes that have been distributed to people who are injecting drugs, and the minimum coverage of 40% of the needs for treatment. And the average in Europe for high-risk opioid users in treatment is only 50%, and in many countries of the EU, this percentage is not going beyond 20%. So we need to continue the effort. There is a need also to sustain those approaches by re-insisting on the respect of fundamental rights for people who are using drugs. And at the same time, we need, as the Commissioner said, we need to continue and strengthen the law enforcement effort, because there is no way to act only on reducing the demand if we don't work at the same time on reducing the supply. So what are the new challenges? Many of them. The first is Europe is more than ever a big production of drugs area, which means that there are consequences and potential consequences in the future. Some of those drugs today are for export, but we already noticed there is a pressure from the offer of those substances on local markets on the territory of the EU. Methamphetamine is potentially a new danger. And when we know the situation and the negative impact for health of methamphetamine use in the US, in Australia, or in Southern Asia, certainly it would be breaking very bad if this was developing in Europe. So we need to act before it is spreading and spilling over the territory of the EU. There may be consequences of changes in Afghanistan, not only regarding the production of heroin, but also, as the Commissioner said, the production of methamphetamine that could be new sources of methamphetamine on the territory of the EU. We need to continue and to monitor and to observe the situation. But we also have the strengthened global organization of organized crime, and the digitalization has been boosted by the COVID pandemic, and it is there to stay, which means higher difficulty, higher complexity, but also new opportunities for law enforcement forces, such as it was demonstrated by EncroChat or Sky-CC. The Commissioner mentioned there is a war in Ukraine. There may be consequences for the Ukrainians in treatment in Ukraine, for people fleeing Ukraine and having need to support and assistance in the countries that are neighboring Ukraine, but also there is potentially an impact on drug trafficking route. And there are already some indications that there may be a higher pressure on the risk for cross-border crime and trafficking between Turkey and Bulgaria, or Turkey and Greece. And then what we should not forget, during and after COVID, there was already an economic crisis, and we have only seen the beginning. Now, the war in Ukraine is bringing an additional dimension to that problem, that in any case will have a negative impact on vulnerable groups. So we need to address those challenges, combining different policies. Last but not least, what are our resources? What can we do? What are the ways in which we can address or anticipate on the problem? First, we have the European drug strategy and the action plan that give a common framework for all the EU member states and the EU to work together on this. What we also know is we have a portfolio of evidence-based responses, and there are new developments, there are new needs, so we need not only to continue to invest, we certainly need to invest more in implementing, making use of evidence-based best practice for demand reduction. We need to continue to monitor trade in precursors, and the fact the report is showing that there is an increase, as I mentioned, of the production of different drugs in Europe, which means the challenge created by chemical precursors diversion becomes now an even more important problem at European level. We have started already during COVID pandemic to invest and to develop activities to strengthen our preparedness, and also for the moment we have expanded this activity to trying to assess what are the immediate consequences of the war in Ukraine for the neighboring countries of Ukraine. And finally, we need to provide even more support for forensic and toxicology labs, because the more we have and produce accurate knowledge about the content of the seizures, the content of the products, but also the body liquids, the forensic examination of people who died from overdose are key to help us better understand those overdoses and try to prevent them. And talking about toxicology, forensic labs, we are celebrating this year a very special 25th anniversary. This is the anniversary of the early warning system on new psychoactive substances. In 1997, it was decided, it was created, it started called a joint action on new synthetic drugs. And it was a very forward-looking initiative from the European Commission at a time where there were not yet so many synthetic drugs discovered on the drug market. Today, we discover one every week. One new drug that was never seen on the European drug market is discovered in Europe every week. And until 4 or 5 years ago, this was 2 NPS a week. It's also the first time that there is a cooperation and close cooperation between public health, but also law enforcement forces with the immediate result. Those results are 884 substances, new substances, have been detected over the last 25 years. We have produced 168 public health risk communication to the member states on those substances and the associated risk. We have performed 37 risk assessments, and on the basis of those assessments, 27 substances have been put under control, first at European level, and then we have shared all the information, all the analysis with WHO and with the UN to feed the process at UN level, which has led in turn to 26 out of 27 substances that have been put under control. So this shows, this illustrates that we in Europe, we can save lives. We are actually already saving lives. The challenge for us now is to learn from the past experience, for the past 30 years of EU drug policy. We need to learn for the present, and on that basis, and on the basis of the scientific evidence, this is the best way for us to anticipate on new risks, new emerging threats, and try to prevent them and to continue to protect our citizens. And therefore, the proposal made by the European Commission, supported by Commissioner Johansson, to modify the mandate of the EMCDDA, to make it even more useful and to make it even more ready to help the EU and the member states to address the emerging threats is extremely important and extremely welcome. Thank you very much.
Thank you very much, Alexis. So now we're ready to start the question and answer session. We've already got 4 questions in, so please keep them coming. I'll just talk you through the instructions for that again. So on the top left of your screen, you click on Agenda, and then you scroll to Question and Answers for Journalists and click on Ask a Question. Please submit your questions in English, and of course you'll have interpretation for that. And if you could also state your name and the organization you represent. So I'll just take the iPad and we'll start with the 4 questions that have already come in. So, you ready?
Yeah.
Okay, so the first question comes from Lorenzo Conzoli. So he's from the Italian news agency Asca News. He's based in Brussels. And he says, my question is about the new mandate approved by the Council and now waiting for the European Parliament's green light. What will concretely change for the agency? Will it also be involved in criminal inquiries? Will it increase its staff and budget? And what new areas will be covered by the annual reports in the future?
Thank you very much for the question. So the first thing is the new mandate, when it will be finally adopted, will give the agency the opportunity to provide much better support to the member states through a future network of forensic and toxicology lab. This is the key tool to understanding better what is happening, not only in terms of overdose, but also where the drugs are coming from, and in particular, what are the components that have been used for their production that, crossed with other indications and indicators, can help us to understand where it comes from, where it has been produced, and trying then to anticipate, providing support and sharing the information with the public health sector, but also with law enforcement forces. So in that perspective, the new dimension, the new areas of work of the agency will allow us to be even more useful, both from the public health perspectives and law enforcement. But we are not a law enforcement agency, so we are not going to run or to be involved directly in operations. But certainly what we already do together with Europol and with national law enforcement forces, and we hope and we look forward to do it more in the future, is to learn to get access to the intelligence when those operations, those investigations have been concluded, to help us to understand better the evolution of drug-related organized crime, local markets, and all the threats and negative consequences, not only for health, that can come from that. There is in the proposal a proposal to increase the staff of the agency. There would be, at the end of the process for the full implementation, there would be 40 more scientific staff in the agency, and the budget would double, more or less, compared with the 2020 budget of the agency.
Okay, thank you, Alexis. So the next question comes from Reuters. This is from Katerina Demoni. She's from Reuters, the Lisbon Bureau. And she says, in the report, the EMCDDA warns that the war in Ukraine could trigger shifts in smuggling routes. Could you explain, please, why a potential shift in trafficking routes could be a challenge for Europe, and how can the EU tackle it before it becomes a bigger and harder to solve issue?
Thank you. Another very important question. Well, the problem with the war in Ukraine, as far as drug trafficking routes are concerned, is that it has a direct impact on what we call the northern route, which means some of the heroin coming from Afghanistan being smuggled through Ukraine or through that region since 2014, where the borders were not completely clear between Donbass, Ukraine, Russia, and where any kind of traffic, not only drugs, was happening. So definitely there is a strong impact of the war in the sense that for drug traffickers, there is absolutely no interest. There are too many risks. It's impossible for them to continue to use this road. Then the problem is that the situation today is not only affecting the territory of Ukraine, but the entire Black Sea, which means that while the Black Sea was used and was crossed by trafficker and by shipments before to reach Ukraine, today it's very difficult for those shipments to arrive even in other ports. Odessa is impossible for the moment, but also Constanța in Romania and even Varna in Bulgaria are much more exposed because it's the entire Black Sea that is touched and impacted by the war, which means that we can safely, based on the preliminary information we have for the moment, we can safely predict that those roads are going to change. They already started changing, and there are already some signs of increase on the pressure for road trafficking between Turkey and Bulgaria, between Turkey and Greece, and I imagine also the sea route through the Greek islands and the southern Mediterranean can be at risk. And so the answer, the way to react is a deeper cooperation between law enforcement forces with the support of Europol, with the support of Eurojust, and also in cooperation with other international organizations. And of course, a closer cooperation with Turkey, which is a member of the EMCDDA, even if still a candidate country to the EU.
Thank you, Alexis. So if you keep your questions coming, that would be great. Somebody's just asked how they can access the report. It should be on the website now in 25 languages. This year, for the first time, we have it in Gaelic. So yeah, the 25 languages should be ready for you to download on the website. So the next question comes from a Mexican journalist, Inda Bugarin, who works for El Universal newspaper, so an old friend of the agency. He says, we know that behind the industrial scale production of methamphetamine are the Mexican cartels in collaboration with European criminal networks. How to respond to this threat in Europe and Mexico? On fentanyl, what is the situation in Europe? Is there a possibility that in Europe the phenomenon that we are seeing with meth will be repeated? Collaboration of Mexican and European criminals for the production of fentanyl in Europe. So maybe I'll repeat some of that.
No,
so,
that's okay.
Is it okay?
That's okay.
Maybe we'll keep it on the screen just in case.
Yeah, many questions, so muchas gracias, Inder. Like always, a strong interest, but a lot of questions. So let's start with the first one. Yes, there is an increased cooperation between organized crime groups from the European Union, inside the EU, and Mexico, and Mexican cartels, especially for methamphetamine. At least the signs and the evidence that we have of that is the fact that there are labs that have been dismantled on the EU territory with the industrial capacity for the production of methamphetamine that were using chemists, as we call them, cooks, that were either Mexicans or that were using the recipes, the methods for the production of methamphetamine, which explained why it's important also to be able to do more profiling of those drugs circulating on the EU territory, which is one of the possibilities the new mandate to be given to the EMCDDA would give the agency. So that's one thing. What we also know from the exchanges of information we have with Europol, but also with the DEA, is that apparently the Mexican cartels have put as an objective to control part of drug trafficking globally. And in that sense, the fact that they seem to be more closely associated to some production units in Europe is kind of confirming that. So at that level, what is being done is stronger cooperation between the EU and Mexico, cooperation between Mexico and Europol, of course, and then the existence of specific programs and the new cooperation group on internal security, CLASI, that has been created a few weeks ago under the French presidency of the EU. So certainly a need for closer cooperation, closer exchanges and more regular exchanges of information. Now, the question for fentanyl, we come back to methamphetamine after. The situation regarding fentanyl and fentanyl production in Mexico is closely linked to the situation in the US with the opioid epidemic. And last year, there were more than 100,000 people who died from overdose due to the abuse of opioids. So that's the situation. But the cause, the roots of the problem are completely different from what we can see in Europe. So for the moment, there is no indication that we are facing the same situation. I need to underline that one of the root causes for the pandemic in the US was the overprescription of painkillers containing opioid, which is not the case so far in the EU. What we have seen in the EU is that there was an increase in the availability of fentanyls. We detected already 12 or 13 years ago through the early warning system on drugs. And in the recent years, fentanyls become the main group of the new substances appearing on the market. But this has decreased, and now there are new sorts of synthetic opioids appearing on the market. It seems that China, from where all those new psychoactive substances were coming, it seems that China has put some of those fentanyl under control, which means that there are less fentanyls detected on the EU market for the moment. There may be a few laboratories, but not yet with the big production capacity. And as I mentioned, we see now, as far as the NPS are concerned, we see the synthetic cathinones that are coming on the market. So there is no way to predict that there will never be a similar situation as far as the production of fentanyl is concerned on the territory of the EU. But still, the situations and the evolution are quite different. And certainly, we need to continue to monitor this to make sure that if there was a change, that we can detect the new threat very quickly. And then finally, on methamphetamine, again, we see an increase in the production side, in the number of production sites with a big capacity for production of methamphetamine. But it seems that for the moment, those methamphetamines, they are produced for export to other regions of the world. Of course, there is no country that can consider itself only as a producing or as a transit country of drugs, as it was the case 30 years ago. So there is a potential risk, and this is why we at EMCDDA, together with Europol, together with the early warning system on drugs, but also with the RATOX network of national focal points, and with complementary sources of information like wastewater, we continue to monitor to detect any indication that there may be a sudden increase in the consumption of methamphetamine.
Okay, so thank you. The next question comes from Sergio Oliveira of Revista Dependências, so a specialized drug magazine in Portugal. He says, we know that the vast majority of drug users are polydrug users, in particular using alcohol. And his question is, why not make use of the existing experience and scientific knowledge and include alcohol among the EMCDDA's responsibilities?
Hola, Sergio. Muito obrigado. Yes, that's a good question, another one. And here the situation is quite simple. In the new proposal made by the European Commission, there is a new, broader definition of what polydrug use is. In the last change in our regulation, it was a minor change in 2007. For the first time, there was a mention or a reference to polydrug use. But it was referring to the use of alcohol together with cannabis, for instance. And of course, this is much too restrictive as a definition compared with the situation as it is today. And this is why the proposal from the Commission contemplates the possibility to broaden the scope of the work of the agency and also to deepen the activities and the different areas and actions it can have. Where there is a difference compared with some member states, alcohol and tobacco are not mentioned explicitly to the full as a fully new area of work for the agency because they are not full area of work and they are not full area of competence for the EU, which means that if there was an attempt to broaden the scope beyond those limits, there would be not even support in the member states, or in some of them, to implement this new regulation. For us, the problem is not about does the EMCDDA would like to work on it or not. We work already on it. But it's how can we work, and do the member states have the means and the commitment, and I would even mention the obligation to provide reporting and to develop better new epidemiological tools? And the answer today is not. We are not ready, not everybody wants to do it, and it is not explicitly in the responsibilities and competences of the EU. So with the new proposal from the European Commission, and it has been supported already by the Council that adopted on the 9th of June its a negotiation position, there is a full consensus, including on that definition, and we are confident that with that definition, if it is finally adopted, we will be able to continue what we do, to expand, but still remaining within the limits and the remit of what the member states have decided together that they would delegate to the European Union.
Okay, thank you. So the next question is on drug consumption rooms. This comes from Daniela De Lorenzo, who's a freelance journalist in Italy, who's interviewed you before, and she's currently working on an article on this topic and was at our webinar last week. So she says, if we look at drug consumption rooms, we can describe them as a success story in Europe, as they helped avoiding millions of deaths from overdose. With regards to the EMCDDA's goal to scaling up harm reduction offer, how is the organization working on this? How can these facilities be mainstreamed in other countries which have not yet implemented these facilities?
Thank you. So another very important question being discussed in many countries overall the European Union for the moment. So the first thing I would like to say is that indeed we have more than 100 drug consumption rooms operating in Europe. Some of them have opened recently. There was one that opened in Brussels, Belgium 2 months ago. There is another that opened more or less in the same time in Athens. There are others that are in preparation. So yes, it is a tool that is part of the portfolio of interventions in the European Union. Is it mandatory to use those tools? Of course not. First, because those are the competences of the member states, but also, more importantly, it has to be associated to an appropriate analysis of the situation and the risk behaviors, because not every single problem is an indication for opening a drug consumption room. Then, and where we are also offering support, and we had the technical meeting 2 weeks ago in Lisbon with drug consumption rooms in Europe. I think one of the key challenges for the drug consumption rooms, for the decision makers, and for us in Europe, is to assess, to evaluate, to understand what are the criteria of best practice, and what are the tools or the advices or the toolkits for people or cities, decision makers who want or think they need to open such a drug consumption room. So the services that the EMCDDA is offering to drug consumption rooms, as well as other interventions such as drug checking or other harm reduction interventions, is a platform for communication and for exchanging experiences, but also problems and questions. Second, this platform is also aiming at providing support for exchange of data, for data collection, because drug consumption rooms, like drug checking and other initiatives, are a key tool and unique tool to understand what is changing now, today. And this is why also there is no dogma about what should be offered as a service in drug consumption rooms. I got some question last year. For instance, we were told that there is no substitution treatment for cocaine, so the conclusion was that drug consumption rooms should not give the possibility to consume cocaine. There is nothing that can be more wrong than that. First of all, it has nothing to do with the fact that there is substitution treatment or not. And second, the question is, Is there an open scene? Are there public nuisances? And what are the risk behaviors and which are the substances? So in Lisbon, after the opening of the new drug consumption room last year, there are 50% of people who come to consume crack cocaine, which is, by the way, showing that there is a much important problem about crack cocaine than what we could imagine even for us who are working and living in Lisbon. In Athens, the drug consumption room is offering a space for the consumption of shisha, that is crystal meth, because there is a very important and problematic open scene with people making use of crystal meth in Athens. So those are responses that are not yet mainstream. We cannot put on the same level drug consumption rooms and substitution treatment, and there is no need to do that. Those are different tools. They are part of a panorama of a set of interventions, and each of them has a role to play. And the last service that EMCDDA is offering to decision makers who take the decision to support the opening of such a drug consumption room, and the professionals who are working on those programs, is to provide scientific and methodological support to understand better what is the impact, what is the effectiveness, and what are the criteria of success. What are the key performance indicators for the success of those interventions? And over the years, in the future years, we are confident that by working together and sharing this space for cooperation with those different interventions, we will first understand better what is happening and what is changing on the drugs field. We certainly will contribute to save lives, but it's not enough to say it. We need to help the programs to prove it. And at the same time, we need to continue the investment in reinventing harm reduction interventions to adapt them to the new challenges of the new drug situation that is not only about heroin or even about crack, but as we have shown this morning, a broader range of substances and hazardous substances.
Okay. So the next question comes from Germany, from Birgit Radatz. She doesn't say where she's from, but she's asking, how do you see the German proposals? How do you see the German proposals to legalize cannabis in the future?
Very good question. Another very good question. I see it with a lot of interest, because for the moment, first, I don't know the details, and we have a meeting next week with the German colleagues and with the German commissioner that is visiting the EMCDDA. We are also following the debate and the discussion in Germany, in Luxembourg, in the Netherlands, and in Malta, and over the coming months, we will be also following some of those technical and scientific meetings. So certainly, those are very significant initiatives. And the countries are very conscious that they need to find a way to take a decision that is first not harmful for the population, because you will see in the report that given, for instance, the very high concentration in THC in the products that are circulating for the moment, there are much more risks to health than what was the case 15 or 25 years ago. So certainly, when someone wants to take such an important decision, the legal status of drug use or cannabis use or cannabis production is only one of the questions. It's also about the edibles. It's about also road safety. It's about quality assurance. It's about prevention. It's about treatment. So all those questions are going to be debated in those 4 countries, including in Germany. I know that in Germany they have started a process that will involve the consultation of hundreds of experts. So we look forward. Also, we have been invited. We will also contribute. And I think what is at stake is what are the possibilities for the countries who want to do it to find a solution that is also compatible with the UN conventions within the global framework of international law. So certainly there is a lot of things to learn. And I would like to add, that at the same time we are following what is happening in the Americas, especially in Canada, because in Canada there is a strong culture of evaluation. And for us it is extremely important to have facts that are reliable, that allow us to really understand how it works, what are the problems, and what are the possible solutions. There is no magic solution, and certainly there are so many fake news and wrong informations regarding is legalization having a negative or positive impact about drug use in the youth. There are many of information that are not true, that are just false, that are just fake, and instead of helping the debate and helping to find a solution, it just creates more chaos. So we need more and better information. We are going to follow, and every time we have been asked, we are asked, and we will also contribute, but providing scientific evidence.
Okay, thank you. So the next question is from Efe, from the Spanish news agency, from Carlota Ciudad. And she says she'd like to have some more information on Spain. She says, what role does Spain have in the fight against drugs? And also, what are the main problems? Did the COVID pandemic change the drug entry points into Spain? And has the type of drugs that enter Spain changed?
Okay, I'm not going to present now the entire situation in Spain, which I think would be better done by the Delegado del Plan Nacional sobre Drogas, but as far as Spain in Europe and what have been the recent changes, this of course I can answer to you. So the first thing I would like to say is Spain is the first country 30 years ago that decided to create a national plan on drugs, and that has appointed a Delegado del Gobierno para el Plan Nacional sobre Drogas that in that time was with the rank of Secretary of State. And the Spanish plan on drugs is supporting the Interministerial Committee on Drugs. It was the first country to do it in the European Union. So certainly Spain is in line with the most advanced strategies and policies and has contributed, including to the spread of better and more integrated and comprehensive national strategies in Europe. And of course, it contributes also to the European strategy and action plan. So that's one. The second thing is that the situation has changed in recent years, not only because of COVID, it has been relatively accelerated for some of its dimensions. And what we can see is that, for instance, 5 years ago, Spain was the entry door of cocaine in Europe. Now it's Antwerp, with a bit of Rotterdam, or at least with connections to the port of Rotterdam, but also with some new haven, like Le Havre, that are increasingly involved in this trafficking. So Spain is extremely active also with the support to MAOC and the activities for the fight against drug smuggling and trafficking from Africa, North Africa, and Europe. Spain is also a key partner and key actor for any kind of cooperation between the EU and Latin America and the Caribbean on drugs. And Spain is also involved in the COPOLAT program that is now the 3rd edition, that is the bi-regional cooperation program between the EU, Latin America, and the Caribbean. So Spain is very active. Spain was also the first country that decided and voted the legislation on assets confiscation. So Spain is very active. The fact that the trafficking routes are changing may have a link with the action of Spain or not, because part of it is more a global and more a geostrategic phenomenon. And therefore, certainly the trafficking and smuggling of drugs to Spain has not stopped. It has changed. What we see, and we discussed with some colleagues from Spain in the recent weeks, the situation as far as drug use is concerned is also changing in Spain. And as I said a bit earlier today, this means that we need to reconsider what we mean, what are the objectives, and especially what are the activities that are being developed under the umbrella of harm reduction, because where there are new substances and new risks, this is where we need to adjust and to adapt the harm reduction intervention. So I would say certainly not a time for less harm reduction, most probably for more, but at the same time different. And last example is the fact that apparently in some cities of Spain, and I invite you to ask to the Spanish Drug Monitoring Center and to the Delegado del Gobierno para el Plan Nacional sobre Drogas, you have in some cities apparently an increase in methamphetamine use that is associated to chemsex, which again shows that everyone can be impacted by the increased availability of drugs, including people who were not necessarily targeted by some classic prevention or harm reduction interventions.
Okay, thank you. So we have 5 minutes left in this session. So the next question comes from Portuguese journalist Samantha Almeida. She's from TSF. She says, with the increasing technological knowledge, how has this contributed to the variety of drugs being produced? And how far are the authorities being able to face the challenge?
Okay, another important question. And I would see two parts in the answer. The first part is most of the molecules that are being produced, it's not necessarily new in the sense that organic chemistry is extremely well developed for years and decades. So potentially the fact that some kind of substances can be produced is certainly or probably easier today because of the investment of organized criminal groups to find new precursors or pre-precursors. Every time that one chemical precursor is put under control, they try to find another solution. So certainly, yes, there is more complexity. The fact that there is more production of synthetic drugs on the EU territory, and not only synthetic drugs, is the fact that you can even find some limited so far laboratories that have been dismantled that had the capacity to transform cocaine paste or cocaine base or opium, shows that certainly there are challenges because now what we see is that the level of equipment of the labs that have been seized compared with 10 years ago, it was quite improvised and it was artisanal. While today it's extremely professional, it's extremely well organized, and as we mentioned 2 months ago when we launched the drug market report, the modules on cocaine and methamphetamine, now you have a tendency in organized crime to provide services to equip in the best possible way standard labs that can be used to produce more or less whatever, depending on what is available as precursors, what are the objectives, and what are the plans of the organized criminal groups, which is also a recent trend. So that part, it's not always entirely new, but certainly it's spreading, and it's much more important than it was 5 or 10 years ago. The second part is what we see is for instance, the proposal from the European Commission to allow the EMCDDA to create a virtual forensic and toxicology lab and a European network is extremely important because the problem is to have access to the tools that allow to do the toxicological, pharmaceutical, and forensic analysis. And there, member states have all the limits. And one of the reasons is not the only one, but one of the reasons is when there is a case that is under investigation, the prosecutor and the police, they don't need a full toxical analysis of the substance. It's enough to have one illicit product contained by the substance, and then the procedure can continue. For the sake of prevention of acute intoxications, overdose, and also understanding better where was those drugs produced, by whom, using which chemical precursors, we need much more. That's one of the things that with the new mandate, as from 2024 and beyond, we should be better equipped. And a Portuguese illustration. I was making reference before to people who are consuming cannabis, who have been already consuming cannabis before, smoking herbal cannabis. And I heard about a case of a young adult consuming cannabis, herbal cannabis, who was sent to the hospital in a complete confusion mental and almost psychosis situation. And basically, most probably, because there was no analysis possible of that herbal cannabis, most probably this has been sprayed, this herbal cannabis had been sprayed by synthetic cannabinoids. So there, where we could help, is help, for instance, provide complementary funding to different services, different labs, but also, for instance, why not services for drug checking like Cosmicare in Portugal. We had a meeting here in Lisbon 1 month ago, because the labs are not always able to detect, for instance, synthetic cannabinoids today in the samples that have been seized. So there is a very concrete way in which in the future we should be able to help even better our partners and to have a better delivery of added value at national and at local level.
Thank you very much. So we've come to the end of our allotted time for this session. There are still some questions coming in. So if you have submitted a question that we couldn't get to now, we'll get back to you on that during the day from our press office. If you have further questions during the day, please send them to press@emcdda.europa.eu, and we'll get back to you on that. We have a team of experts at hand today who are asking questions according to their subject area and by language. So we'll have a team ready to answer the questions during the day. As I say, there are some very interesting questions coming through, but unfortunately we can't deal with them at the moment. So finally, I'd like to thank you all for having joined us today, and thank you for your interest. Thank you to our distinguished guest speakers as well. Thank you to the technicians and the interpreters and everybody who helped to put this event together. And so thank you to Alexis for answering all the questions. And so for now, it's goodbye from Lisbon, Stockholm, and Vienna. We hope to see you again next year. And I declare this press conference closed. Thank you very much.